Hello everyone, welcome to the Career Pathway channel where we guide nurses on their pathway to success. Today we'll be looking at a very crucial, important topic for nurses. Okay, so basically every person in the health sector needs to know this. Okay, so let's begin. We'll be looking at the nursing responsibilities and intervention in underwater seal drainage. So basically for this topic, there are some contents we'll be following. So content 1 talks about introduction to underwater seal drainage, components of a chest drain system, indication to chest drain insertions, insertion and management, nursing management for a chest drain, complications and troubleshooting. Then, if you stay with me to the end of this video, we'll examine NCLEX perspective on underwater seal drainage, and we'll take a sample question from NCLEX and then we'll tackle it together. So we want to look at the introduction to underwater seal drainage, and as a way of introduction, we'll have to define what underwater seal drainage system is, the purpose, working principle, and then indication. So let's begin. What is an underwater seal drainage? An underwater seal drainage can also be called a chest drain, a chest drain system. It is a medical procedure used to remove air, fluid, or pus from the pleural space in the chest, commonly after a trauma or a surgery. So, what is the purpose of an underwater seal drainage? The purpose of an underwater seal drainage is to prevent or treat pneumothorax. Pneumothorax is actually the collapse of the lungs. It could also be used for hemothorax, which is blood accumulation in the pleural space, and pleural effusion, which is fluid accumulation in the thoracic cavity, allowing the lungs to re-expand. So the purpose of this underwater seal drainage is actually to allow the lung to re-expand. What then is the working principle of the underwater seal drainage? So we'll be looking at the working principle and then the indications for underwater seal drainage. How does it work? It works by inserting a drain tube into the pleural cavity, which connects to an underwater seal externally and then prevents backflow of air or fluid into the chest. There are several indications for underwater seal drainage system. When do we use this, or when is this used for patients? It is used for patients with diagnosis of pneumothorax, air in the thoracic cavity. Of course, hemothorax, we've explained that before, pleural effusion, and lastly, it is used for patients with who had undergone surgery. Patients that have undergone thoracic surgery is an indication for underwater seal drainage system. Now, let's look at the components of a chest drain system. And under the components of a chest drain system, we want to assess the contents and then the features of an underwater seal drainage system. Components of a chest drain system. Components of a chest drain system includes 1. Chest drain tube. The chest drain tube is actually inserted through the chest wall into the pleural space to remove air, fluid, or pus. If you took note of the image that was shown on the slide before this one, you will see a diagram, a typical diagram of an underwater seal drainage. And there you will see the chest drain tube. The chest drain tube, it could be single lumen tube, it could be a double lumen tube, depending on the specific condition. The second component we want to look at is the underwater seal chamber. The underwater seal chamber actually contains water, just as the name implies. It prevents air, so this water helps to prevent air from entering the pleural space, creating a seal. It also allows air or fluid to escape, but ensures that they do not return to the chest cavity. So basically, you have to do this because one thing you have to know about the chest is that it has a negative intrathoracic pressure. And what that means is that it has the ability to receive back or a backflow of air or fluid. into the chest. So what this tube does, since it's dipped into the water, it will prevent air from going back into the chest region. Thirdly, on the components of a chest drain system is the collecting chamber. The collecting chamber collects fluid or air drained from the pleural space. The amount and color of the drainage is monitored rather to track progress and detect any issues. So basically a collecting chamber is used to track if there are any issues. So basically it collects the fluid. So fourthly, on the components of a chest drain system is the suction control. Suction control may not be found on some type of chest drain systems. But what does it do? Some systems use suction to help drain fluid, especially when a pneumothorax is involved. So basically, a control is needed if it is a condition of a pneumothorax. Okay, water or dry suction control helps to maintain appropriate level of negative pressure. Like I said before, the chest has a negative intrathoracic pressure, and the suction control helps to monitor and prevent backflow of air into the chest cavity. There are indications for chest drain insertion, and here we'll be discussing when to use an underwater seal drain. So first on our list is with patient with pneumothorax, patient with collapsed lungs. So basically, for pneumothorax, there is air accumulation between the pleural space and the lungs. This causes the lungs to collapse. So a chest drain will help to re-expand the lung and then remove trapped air. So other patients where the underwater seal drainage is used in the hospital is on patient with hemothorax. Hemothorax simply talks about blood in the pleural space. So blood collects in the pleural cavity due to trauma or surgery. So when a patient has traumatic experiences on the thoracic region, there could be accumulation of blood in the thoracic cavity. So the chest drain will help to remove the blood and prevent further complications. Third on the indications are for patients with pleural effusion. Pleural effusion simply means fluid accumulation in the thoracic cavity. So fluid, pus, serous fluid or blood is collected in the pleural cavity. So what does the uh, underwater seal drain do? The underwater seal drain has to, help to remove the excess fluid, allowing the lungs to expand and function properly. Lastly on our list is for patients who had undergone surgical operation. So chest drain are often used after surgeries like thoracic surgeries or lung surgery to remove air, blood, or fluid post procedure. Okay, so after the procedure have been carried out, there could be accumulation of air in the thoracic cavity, and it has to be drained using an underwater seal drainage. Insertion and management of the chest drain. How is the chest drain inserted? You have to know that this procedure is usually done by the doctors. So basically, under insertion and management of the chest drain, we want to assess the procedure for the chest drain, and then we'll look at the proper placement of the chest drainage system. Procedure overview and proper management. So basically, for the procedure overview, the first procedure is performed under local anesthesia or sometimes general anesthesia. A small incision is made on the chest wall and the chest drain is inserted into the pleural space. Now, for proper placement, the chest drain should be placed in the fifth intercostal space at the mid-axillary line. So this is to ensure that there is optimal drainage. Please take note, it has to be inserted in the fifth intercostal space, although the doctor does this, but the nurse you have to check. And then it has to be in the mid-axillary line. So basically, for the nurses, we have to examine our own responsibility as nurses. So under our nursing responsibility, we want to take care of the tube. Very importantly, we also want to consider the patient. Nursing responsibility in underwater seal drainage. Number one, monitor for complications such as infections or displacement. So basically, we want to check if there is displacement in the tube and then we want to monitor if there are infections. Secondly, we want to ensure patency of the drain and maintain the integrity of the underwater seal. We want to ensure that there is continuous monitoring. We want to ensure that there is no infections. There are no infections. And then thirdly, we observe the drainage output. In observation of the drainage output, we have to then consider the amount of purulent, the color, and then the consistency. This should be done regularly. Okay. So lastly, on nursing responsibility, we have to keep the collection chamber below the chest level to promote drainage. So it should be kept below the chest level and not above. Like I said before, it should not be above because the chest, the thoracic region, will have to take a flow back of the fluid if it is not below chest level. Utilizing the STOP or STOP acronym for easy remembrance and clear relevance. So for us as nurses to have this information handy, I have broken the steps to uh, examining or taking management of the underwater seal drainage into 4 steps, and that's the STOP acronym, the STOP acronym. Nursing responsibilities and management. How do we manage patients on chest drain system? We have to take the STOP, and under the STOP acronym, S stands for sites. So for the site, there are points to note. We need to monitor the site for leakage. After the first incision, the first day of incision, 2 days is usually given. Then we check the suture. We want to check for proper, if the suture have not eaten from the skin, right? We want to check that there is no infection or there are no infections. Then you check for if the suture is still intact, and then you carry out wound dressing. There is need to check the wound, okay, to prevent infections. Next on the STOP acronym is the T. T stands for the tube. We have to care for the tube. And how do we care for the tube? We care for the tube by noting the following. Examine the length of the tube regularly. If the length of the tube post-surgery is 15 inches, let's assume, and then tomorrow we are checking and there's 20 inches, it means that there is a dislodgement. It means that the tube is pulling out of the patient's chest. So we have to check because a consistent length will indicate that the patient is fine. Secondly, on the tube, we have to check the drainage contents. Okay, if it is pleural effusion initially, we'll see that the fluid from the chest is purulent. However, after some times, it becomes less purulent, and then if you notice blood, then it could be that the tube has hit a vessel. If there is blood drain instead of purulent, then it means that there is a dislodgement, and then it means that the tube may have hit a vessel, and we have to report that. There is also monitoring for oscillation of the fluid column. So how we do this is to tell the patient to breathe in and breathe out. So when the patient breathes in, take in breath, inhalation and exhalation, we are going to see a kind of oscillation on the tube, and that indicates that the tube is correctly placed. Thirdly, on the STOP acronym is the output. So we need to examine the output. We examine the output by taking note of the following. Check fluid output and record how many mils is being drained. If the seal drainage becomes full, you have to clamp with an emergency clamp. Then you drain out, empty, then fill it with water. It has to be water first, okay? Fill with water, then ensure proper placement. Note that the initial level is not added to your calculation. So if the initial level is actually the level where you put the water up to. So you don't calculate that as part of the exudate or as part of the purulent. Okay, so you don't add that. The quantity is necessary as it serves as an indication for proper recovery. If the exudate that we got today from the underwater seal drainage is let's say 30 mils or 500 mils, by tomorrow we expect it to be 400 mils. By next tomorrow we expect it to be 300 mils. So if there is continuous decrease in the exudate being drained, then it's an indication that the patient is recovering. Ensure to add water up to the initial level after emptying the drainage. Lastly, on the STOP acronym is the patient. So if you are doing everything right, the patient should get better. This is evidence from the objective data obtained from the patient. So basically, if we are doing all 3 points correctly, we are monitoring the tube, we are checking the outputs, then the patient should get better because purulent drained should reduce consistently, and we get all evidence from the objective data such as blood pressure. So the blood pressure should be fine. So the patient temperature should go to normal. The pulse should be normal. So if things are normal, then it means our patient is consistently recovering. Post care after insertion. So on post insertion, we have to check our patient position. Ensure that the patient is in the correct position that allows for proper drainage. The position that's proper is a semi-sitting position. We have to also use chest x-ray to confirm the placement of the chest drain and check for proper lung re-expansion. Okay, basically the tube that has been inserted into the chest is actually radio opaque. So when we put it under the x-ray, we are going to see the correct placement. Are there complications? Yes, there are complications to underwater seal drainage, and then we have to check what the nurse should do in terms of troubleshooting. Some of the complication includes, they include infection. Due to improper aseptic technique, during insertion or dislodgement, there could be infection. There could also be accidental dislodgement. The chest drain can become dislodged, leading to air or fluid re-entering the pleural space. Thirdly, there could be a blockage. The tube may become blocked, leading to reduced drainage and possibly causing a reaccumulation of air or fluid. So we need to check for blockage. So lastly, on the list of complications, the most important complication we have to check out for is tension pneumothorax. It is a serious complication if air is trapped in the pleural space and the chest drain is not working correctly. So basically, for chest drains, we have to monitor and prevent tension pneumothorax. That's why we need to monitor the tube. Okay, troubleshooting. What should the nurse do? If there are no bubbling in the underwater seal, is a red flag. This could indicate that the chest drain is blocked or kinked. Ensure the system is not clamped and that it is properly positioned. Continuous bubbling in the seal could indicate that there is air leak. So if there is continuous bubbling, you should know that there is a leakage. So, and there is a disconnection, we have to check that. If the drain stops, we have to reposition the patient or ensure that the tube is not kinked. Check if the drainage system is still intact and functional. So guys, you have to monitor and document. It is being said that care not documented is care not rendered. So we have to record the amounts, the type, and then the color of fluid drainage, and this should be done regularly. Ensure proper documentation of the procedure, patient response, and any complications encountered. So we have to record the patient's response, and we need to also record if there are any complications encountered. So let's take some questions. Let's try our hands on some questions now. You've tried watching this video thus far. Question number 1. Why is the system called an underwater seal drain? Okay, you should answer that. Question number 2 is actually the NCLEX perspective. I got this question from an NCLEX document, so let's read. The patient is evaluating, the nurse is evaluating the patient's or the client's response to treatment of the pleural effusion with a chest tube. The nurse notes a respiratory rate of 20 breaths per minute, fluctuation of the fluid level in the water-sealed chamber, and a decrease in the amount of drainage by 30 ml since the previous shift. On evaluation, which interpretation will the nurse make? 1. The client is responding well to treatment. 2. Suction should be decreased to the system. 3. The system should be assessed for an air leak. 4. Water should be added to the water sealed chamber. What is the answer to this question? Let me know your answer in the comment section of this video. So guys, I want to thank you for staying tuned to this end of this video. Please, if you have not subscribed to our YouTube channel, please do subscribe and hit the notification bell for future videos like this. So I want to thank you for your patience. I believe we'll see soonest.